This is Average Joe PT, and today we're going to talk about hip trauma. And when it comes to the hip, there's a lot of things that can go wrong when you fall, when you get into a car accident, maybe some sort of pickup, football, baseball, whatever kind of sporting event. So I want you guys to stick around and figure out if it's something that you need to worry about. So stay tuned. Now, hip trauma is really crazy because sometimes it can be just a muscle group that's causing a lot of the problems. Like right here, the iliopsoas, which really is two separate muscles that kind of merge together to make up one specific tendon. Or it could be something as simple or as not so simple as a fall. You actually fracture the hip. And so if we look at the spine here and we look at the tailbone, when you fall, you could fracture the hip, you could fracture your sacrum, which is what this orange bone represents. You could fracture your tailbone. A lot of people, when they fall straight down like that, they end up fracturing that tailbone. And unfortunately, when it comes to that, they can't even fix that. They just let it just stay, and hopefully it heals up and you don't have any more symptoms. What they'll do a lot of times is they'll make people sit on a donut if they break that coccyx area or tailbone. So I want you guys to think about that when you fall. Sometimes you better sit there for a second and make sure you haven't done anything seriously to yourself. Now, if you start having symptoms like radiating burning, if you start having numbness, if it feels like you can't move the joint at all, then you better seek medical attention immediately, because it might not be just a muscle pull like I showed you. It might be a fracture of any of those segments. And so that one segment, I'm going to zoom up close here on you, really close, and you see this segment right here. That ball, when it comes off right there, that socket could get fractured, or the ball itself, the neck, or the shaft could all get fractured. And then at that point, you're gonna have to have surgery. Maybe it's a rod, maybe it's pinning, or maybe it might be a total hip replacement. So I want you guys to go ahead and click up there after the video, because that goes over some other types of problems that you can have in your hip besides what we're going to talk about today. So I want you guys to stay tuned. So let's just talk a moment about repetitive trauma in the hip. So let's say you're just squatting a lot, whether it's it's the type of work that you do, or maybe you're just down there in this position a lot. That kind of rotational movement that happens at the hip, rotating at that ball and then squatting down all the time, starts to wear on that ball and socket. Because that ball and socket is really just lined with cartilage. You have a thin layer of cartilage over the ball, you have a thin layer of cartilage over the socket, and then you have this tissue in between that kind of holds the two together, which is called the labrum. Now that labrum can also get a tear in it, and that can also catch and give you a lot of pain. And I have a couple of videos on my hip side. When you want to go and look into that video, it goes over labral tears, treatments for it, surgery for it if it needs to have surgery, injections for it. So if you want to go and look at that, just go ahead and click up on that spot right there, and it goes over labral tears of the hip. Now, we talked about fractures, we've talked about the tendon and muscle issue, and a lot of times you'll see videos out there where they're just kind of stretching that area out. Now, if it was a stretch injury that caused that trauma to begin with to those muscles, the last thing you want to do is stretch it, all right? We want to just rest it, maybe put it in a nice rested position, which would be a shortened position like this, and just ice it, give it 4, 5, 6 days of really not doing anything. Let that tendon and muscle that I showed you earlier just kind of shorten and get into a healing position again versus always stretch, because that's the trauma that caused it in the first place. And then after maybe a couple weeks, then start to gently go into stretching. Now I have a couple of videos out on just stretching in the hip too, so you can go ahead and look at those when you want to under my hip videos. So I want you to stick around, because I'm going to talk a little bit more and show you some cool stuff about the hip. So stay tuned. Alright, I'm going to show you some cool stuff, some little fun facts. Fun fact number 1, when we're first born and as we grow, your socket and the ball, alright, the ball is much larger than the socket. The socket is very shallow when we're young, and as we weight bear and walk, and as we do activities, it gets deeper and deeper and larger. So it's very important when we're young that you don't have your kids what we call Indian style or W sitting or crisscrossing, any of those types of positions that could stress that ball and socket in the wrong direction would be very bad when you're young, because that's all growing. Ball's getting bigger, the socket is getting shaped appropriately, and all the labrum and the tendons and the muscles are also growing too, and we want to make sure they all grow in the right direction, and the depth also too, so you don't have issues as you get older. And so that's fun fact number 1. Fun fact number 2, when you're running or when you're jumping or anything like that, people have a tendency to want to land on their dominant side. And so as we age and things wear, a lot of times you want to check that dominant side first when you're having pain, even if the injury's on the other side, because we want to see if there's any type of excessive wear going on just through repetitive trauma like I talked about earlier. So that's fun fact number 2. And fun fact number 3 is you have this weird little muscle on the back side of your hip here, and that is right where the nerve, the sciatic nerve, comes through right there. And if that muscle gets pinched or irritated, that nerve can get irritated too, which is your sciatic nerve, and start giving you symptoms down your leg. So fun fact number 3 is a lot of times we have to figure out if you're having pain down your leg, whether the pain is coming from your spine, or whether the pain is coming from your hip, or if the pain is just coming from specifically a muscle group in there is causing your symptoms. So that's fun fact number 3 for you all. So I want you guys to stick around here, and we're going to go ahead and show you one more thing. Stay tuned. Now, Skully and I would love to have you guys join our channel. Become a member, subscriber, hit the bell so you guys get our video content. We try and do it at least once or twice a week when it comes to the videos. These videos do take a little bit of time to make. If you have any questions, positive or negative, hopefully you'll give us a shout out. And until next time, Skully and I always like to say look up and keep smiling. See you next time, folks.